Hello, my name is Professor Iqbal Shergill. I'm consultant urological surgeon here in Wrexham and also Treasurer-elect for British Association Urological Surgeons, BAUS, as well as BAUS trustee. Sincerest apologies for not being able to attend this webinar in person, but unfortunately had a pre-arranged rendezvous in Paris for an important event. Getting It Right First Time, or GIRFT, is an NHS programme which is designed to improve the quality of care within the NHS by reducing unwarranted variation. Essentially, by tackling this variation in the way services are delivered across the NHS and by sharing best practice between trusts, GIRFT then can identify changes that will help improve care and patient outcomes, as well as delivering efficiencies such as the reduction of unnecessary procedures and cost savings. Urology was a very early GIRFT specialty, and work was done over several years across the whole of the NHS England, and a national report was then published which we'll discuss. Subsequently, after review by GIRFT and BAUS, implementation was initiated and then continued until the pandemic. The 2018 GIRFT National Specialty Report on Urology demonstrated quite clearly a wide variation in practice across the NHS and highlighted the need for improvement in urological practice in a range of areas. The recommendations are listed in the next two slides. So with respect to GIRFT methodology, the starting point in the quality improvement process is the recognition that some aspects of care are suboptimal. While this is apparent to some of those who are delivering services, the GIRFT methodology of data analysis and clinically led conversations with frontline staff definitively demonstrated that we can all do better. The GIRFT Best Practice Academy aims to identify good practice and provide guidance on service improvement, particularly focusing on common conditions and frequent interventions, thereby maximising impact. The GIRFT Academy developed this guide on the management of bladder outflow obstruction to support the implementation of good practice. Importantly, this comes at a time when the management of this common condition is both improving and getting more complex. The guide describes the key features of a contemporary and comprehensive bladder outflow obstruction service and acts as a guide for teams who are committed to high quality care. Importantly, it will also aid the identification of potential gaps in the current service and offer practical advice that will then help the multidisciplinary team. Several key points are raised in the executive summary as outlined here. We will go through some of these in the next few slides. The bladder outlet obstruction pathway covers the various modes of presentation for men with problematic urinary symptoms, with the aim not to overcomplicate. It gives guidance on first presentation, what urological services should be providing, as well as discharge and follow-up recommendations. The four broad categories are painful acute urinary retention, chronic urinary retention, bothersome LUTS, and then red flag symptoms. In this pathway, guidance is also given regarding one-stop assessment, as well as all the different modern and contemporary treatment options which may be available. A few of the components of high-quality bladder outflow obstruction care will be outlined in the next few slides, demonstrating good practice in bladder outflow obstruction pathway. With respect to managing patients in a timely manner to improve patient outcomes and experience, several key quality actions were listed. One of the examples that were given in the document including waiting list management using SMS messaging from Southampton. With respect to providing a one-stop service for patient assessment, two key centres in Imperial College and also in Scotland have shown significant improved efficiencies in one-stop outpatient clinic assessment of male patients with lower intract symptoms. Providing high quality information to patients is important, and Recommendations are to review the portfolio of patient information that's available and ensure that patient decision aids are available to facilitate discussions. Importantly, national bodies such as BAUS are at the forefront of this and are leading on this key quality action point. Furthermore, offering a comprehensive range of treatment options within a urology area network is critical here for patients. The days of every surgeon providing every treatment are gone and are not efficient anymore. What's clear is that in a specific area network, the expertise should be harnessed. For example, referral to whole-lip surgeons or referral to resume surgeons or urolift surgeons. Finally, the importance of maximising the use of day surgery and improved recovery pathways. Day case surgery is here, and many of the BPH treatments, which we'll hear about today, can be offered as day case surgery. Furthermore, patients with catheter in situs need to have options and availability for early catheter removal after surgery, for example. So in summary, GIRFT, or getting it right first time, is an NHS program which is designed to improve quality of care within the NHS by reducing unwarranted variation. And in simple terms, it could be used in all clinical practice throughout the world to tackle variation in the way services are delivered, and then by sharing best practice between centres. GIRFT is quite confident that it will identify changes that will improve patient care and patient outcomes, as well as delivering efficiencies such as the reduction of unnecessary procedures and cost savings. Many thanks for your time and attention.